Have you ever wondered what supraventricular tachyarrhythmias are? A term that may sound like a tongue twister, but it's an important concept in the field of heart health. In essence, supraventricular tachyarrhythmias, or SVTs for short, are tachyarrhythmias that originate in the atria or AV junction of the heart. Now, what does that mean? Well, in simpler terms, these are rapid heart rhythms that start in the upper chambers, or the junction box of your heart. Quite interesting, isn't it? Now, one of the key characteristics of SVTs is a narrow QRS complex on an EKG. This QRS complex represents the electrical impulse traveling through the heart ventricles. In SVTs, this happens more quickly than usual, resulting in a narrow QRS complex. So there you have it, a basic understanding of supraventricular tachyarrhythmias. Understanding supraventricular tachyarrhythmias gives us a foundation to explore its different types. Get ready to discover more in the next few scenes. Let's dissect the first type of SVT, sinus tachycardia. This is a sinus rhythm that exceeds a rate of 100 beats per minute. Now, this elevated heart rate can occur in perfectly healthy individuals. Factors such as exercise, heightened emotions, pain, alcohol use, caffeinated beverages, and certain drugs like beta-adrenergic agonists and anticholinergic drugs can trigger sinus tachycardia. But it's not all about lifestyle. Medical conditions like fever, hypotension, hypovolemia, anemia, thyrotoxicosis, congestive heart failure, myocardial infarction, shock, pulmonary embolism, and more can also be the culprits. So how do we manage sinus tachycardia? It's all about treating the underlying disease first. If symptoms persist, B blockers might be considered, or a calcium channel blocker if B blockers are contraindicated. Sinus tachycardia, though common, can be managed by treating the underlying disease and considering certain medications. Moving on, we encounter another type of SVT, premature beats. These beats come a bit earlier than the normal heartbeat and can be of two types. First, we have the premature atrial contraction or PAC. This is an ectopic supraventricular beat that originates in the atria. The P-wave morphology of the PAC usually differs from that of a normal sinus beat. The second type is the junctional premature beat. This is an ectopic supraventricular beat that originates in the vicinity of the AV node. The P-wave with this beat is usually not seen, or an inverted P-wave is seen and may be before or closely follow the QRS complex. While these premature beats might seem alarming because they disrupt the regular rhythm of the heart, they are usually harmless. Most of the time, they do not require treatment. Premature beats, although alarming, are usually harmless and do not require treatment. Next on our list is a more complex type of SVT, atrial flutter. This is a condition characterized by rapid, regular atrial depolarization, resulting from a macro re-entry circuit within the atrium, most commonly the right atrium. In layman's terms, it's like a racing heartbeat, but not just any racing heart. It's a heart that's running a very specific track, over and over again, at a dizzying speed. Picture your heart as a race car, but instead of a sprawling track with twists and turns, it's stuck in a loop, going around and around at a breakneck speed of 250 to 350 beats per minute, typically around 300. Now, what puts the heart in this relentless loop? Several factors can set the stage for atrial flutter. Coronary artery disease, or CAD, can be a culprit, creating conditions in the heart that make it prone to this kind of rapid, repetitive rhythm. Thyrotoxicosis, a condition caused by an excess of thyroid hormone, can also play a part. Mitral valve disease, cardiac surgery, chronic obstructive pulmonary disease, pulmonary embolism, and pericarditis are other potential triggers. So how do we deal with this relentless race? Well, the treatment plan depends on the patient's overall condition. If the patient is unstable with symptoms like low blood pressure, congestive heart failure, or angina, electrical cardioversion is the go-to. This is a procedure that resets the heart's rhythm with an electric shock. If the patient is stable, we aim for rate control with medications like beta blockers, diltiazem, verapamil, or digoxin. Another approach is chemical cardioversion, using drugs like sotalol, amiodarone, or type 1 antiarrhythmics. And in some cases, an electrical cardioversion might be the best option. In the long term, antiarrhythmics or catheter radiofrequency ablation may be recommended. This procedure uses radiofrequency energy to destroy the area of heart tissue causing the rapid rhythm, with success rates depending on the origin site of the atrial flutter. Atrial flutter can be managed with the right treatment, and understanding of the condition is key. So let's continue our journey into the world of supraventricular tachyarrhythmias. Lastly, we delve into multifocal atrial tachycardia, or MAT. This is a fascinating cardiac arrhythmia, characterized by an irregular rhythm caused by the presence of 3 or more atrial foci. In simpler terms, MAT is a form of heart rhythm disorder where multiple sites in the heart's atria start sending signals all at once. This results in a rapid and irregular heart rate, typically ranging between 100 to 200 beats per minute. The unique aspect of MAT is the distinct P-wave morphologies and varying PR intervals that can be observed on an electrocardiogram, or ECG. In some cases, certain P-waves may not even be conducted, adding to the complexity of this condition. Now you might ask, who is most susceptible to MAT? Well, it occurs more commonly in patients with chronic obstructive pulmonary disease, also known as COPD, and hypoxemia, which is a lower than normal level of oxygen in your blood. Less commonly, it can be observed in patients with hypokalemia, which is low potassium levels in the blood, hypomagnesemia, low magnesium levels, sepsis, and even due to toxicity from medications like theophylline or digitalis. So, how do we address this condition? The key to treating multifocal atrial tachycardia lies in addressing the underlying cause. This could involve managing COPD, treating hypoxemia, or adjusting medications that might be causing toxicity. In certain cases, calcium channel blockers like diltiazem or verapamil may be used. However, beta blockers, another common treatment for tachyarrhythmias, may be contraindicated because of severe pulmonary disease. It's important to remember that every patient is unique and treatment plans should always be tailored to the individual. Multifocal atrial tachycardia is a complex condition that requires careful management and treatment. Through understanding the underlying causes and potential treatments, we can better navigate the challenges this condition presents. Understanding multifocal atrial tachycardia is crucial, as it is a condition that needs careful management and treatment. We've covered a lot about supraventricular tachyarrhythmias. From understanding the irregular heart rates originating in the atria or AV junction, to the various manifestations like sinus tachycardia, premature beats, atrial flutter, and multifocal atrial tachycardia. We've also delved into the causes, symptoms, and potential treatments for each of these conditions. Remember, each has its unique characteristics, yet they all fall under the umbrella of supraventricular tachyarrhythmias. With this knowledge, you're well on your way to understanding and managing supraventricular tachyarrhythmias.